And acting causes diabetes. The surprising reason some experts think Tom Hanks' career led to him developing the disease.
You're watching Fox 45 Morning News. All local, all morning.
Actor Tom Hanks just revealed that he's been diagnosed with type 2 diabetes, and he says his career may be to blame. The actor says he lost and gained weight for different roles, and the back and forth weight gain wreaked havoc on his health. Dr. Allison Massey with the Endocrinology Center at Mercy Medical Center is joining us this morning to explain why this is a problem, and not just for him, but for anybody.
Right, so most people in America that have diabetes actually have type 2 diabetes.
Okay.
So Tom is amongst the 90% of that group that has diabetes that has type 2.
Type 2, explain what type 2 is.
Right, so type 2, there's different risk factors for type 2. You know, weight status certainly is one. Family history, which I'm not sure about Tom Hanks, but that's a strong risk factor.
Okay.
Sedentary lifestyle, you know, if women have had gestational diabetes, that puts them at risk as well for type 2.
Can you correct type 2 diabetes?
So we can manage type 2 diabetes, and that's the positive message here. We have the lifestyle factors that can manage it, and you know, certainly there's many medications as well.
But is his, I guess, accusation of how he got it, is that warranted? I mean, is that really it? Is the yo-yo dieting
Well,
an issue?
you know, certainly there's limited studies on that, but you know, yo-yo dieting would put stress on the pancreas, which is the organ that's producing insulin in the body.
Okay.
So, you know, that could be a factor. There could be other things that put him at risk for getting the disease
So
as well.
there's a whole list. Can you tell me some of the symptoms that you'll see in case somebody may be issuing, like, I may have diabetes?
Sure. So the scary thing is actually the body kind of adjusts to elevated blood sugar levels. So sometimes until the levels get extremely high, people may have no symptoms.
Okay.
And that's why we encourage people to go to their doctor, obviously, and
Right.
get their blood tests done. Extremely high blood sugars, however, can cause frequent urination.
Okay.
You might feel really thirsty, you know, dry, itchy skin, blurry vision. Those are just some of the things to watch out for.
Okay. And faint tendencies of like feeling like you're faint when it comes to before or after eating, is that a part of it?
So that could be a symptom of low blood sugar when people have diabetes in general. You know, they might feel kind of faint, as you say, and
Really?
that's why, you know, eating a healthy diet is really important, and that's part of this whole piece in terms of managing.
Okay. So last question for you then, the main differences between 1 and 2 type.
Sure. So type 1 diabetes is an autoimmune disease, whereas type 2, you know, there's certainly, they're producing insulin. It decreases over time, but then there's an insulin resistance piece as well to that disease. So they're quite different.
Well, thank you very much.
Sure.
Dr. Allison Massey, thank you very much for coming in and
Thanks so
explaining
much.
this.
Thanks.